Hello friends, welcome back to my YouTube channel. Airway management is the first and most critical step in any surgery. But what happens when the airway is difficult, when conventional laryngoscope fails? Today we are looking at a technology that is changing how we secure the airway, the BD video laryngoscope. In the next 7 minutes, let's understand what it is, how it works, and why it's becoming the standard of care in modern OR and ICUs. The problem with the traditional laryngoscope. For decades, anesthesiologists have relied on direct laryngoscopy using Macintosh or Miller blades. The principle is simple: lift the tongue and epiglottis to see the vocal cords, then inserts the endotracheal tube, but it has limitations. First, it requires a direct line of sight. In patients with limited neck extension, obesity, or facial trauma, that line is often blocked. Second, it is a one-person view. Only the intubator sees the codes. If the tubes goes wrong, the assistant can't guide you in real time. Third, repeated attempts cause trauma, edema, and hypoxia. Studies show first pass success rates drop to 60 to 70% in difficult airways with conventional blades. That's where video laryngoscope steps in. The BD video laryngoscope is a portable video assisted intubation device designed for both routine and difficult airways. BD here refers to Beckton Dickinson, a global leader in medical technology and patient safety. The system has three core components: reusable or disposable blade with HD camera. The blade tip has a high definition CMOS camera. It captures the high view of the glottis and transmits it live. High resolution LCD monitor, a 3.5 to 5-inch anti-fog screen mounted on the handle. It displays the airway anatomy in real time in full color. Ergonomic handle, angled at 60 degrees. The hyper-angulated blade reduces the need for lifting force. It follows the natural curvature of the airway. No separate light source or cables needed. It is battery operated, chargeable, and ready in under 10 seconds. The key features and advantages. Let's break down why BD video laryngoscopy is preferred in hospitals today. Improved visualization. The camera at the tip gives you a round the corner view. You don't need to align oral, pharyngeal, and laryngeal axis. Even a Cormac Lehan grade 3 airway can look like grade 1 on screen. This directly increases first pass success rate to over 95%. Shared view, better teamwork. The entire OT team can see the airway on the monitor. The assistant can guide the tube section when needed and confirm the placement. It is excellent for teaching. Residents can learn intubation without struggling for a direct view. Less force, less trauma. Because of the hyperangulated blade, the video guidance, you need 40 to 50% less lifting force compared to Macintosh blades. That means less dental trauma, less core throat, and less hemodynamic stress for the patient. Many BD models have inbuilt recording. You can capture images and videos for documentation, medico legal records, and training purpose. It's a powerful tool for simulation labs and skill labs. Infection control. BD offers both reusable steel blades with autoclavable cameras and single-use disposable blades. In COVID and post-COVID era, disposable blades reduce the cross-contamination risk significantly. Where do we use it? Routine intubation, faster, smoother, better for junior staff. Predicted difficult airway, obsess patients, cervical spine issues, limited mouth opening, head neck cancers. Emergency and ICU intubation, crash intubations where you can't afford multiple attempts. Pediatric intubation, special pediatric blades with a smaller profiles are available. Teaching hospitals as a teaching aid, it bridges the gap between theory and practice. The technique is simple. Insert the blade midline, advance until you see the epiglottis on screen. Lift slightly, identify the chords and railroad the tube. The screen gives you confidence even in challenging anatomy. BD brings three things to the table: reliability, ergonomics, and global trust. The optics are highly definition with an anti-fog coating. The battery lasts 2 to 3 hours continuous use. The device is compact enough for crash carts and ambulance use. Most importantly, BD focus on patient safety means every blade and handle is tested for durability and biocompatibility. Hospitals across India, include tier 2 cities, are now adopting BD video laryngoscope as part of their difficult airway cart. The BD video laryngoscope is not just a device, it is a safety net. It improves visualization, increases first pass success, reduces trauma, and makes airway management a team effort. Where you are a tertiary OR and ICU or handling emergency airways, this is one technology that deserves a place in your setup. If you don't like a hands-on demo training session for your anesthesia team or details on disposable versus reusable options, contact your BD representative today. Because in airway management, seeing is believing, and with BD, seeing is securing. Thank you guys for watching my video. Please like, share and subscribe my all videos.